10 Hidden Liver Dangers of Diabetes Revealed. Did you know that nearly 40% of people with liver cirrhosis in the United States also have diabetes? This isn't just a statistic, it's a wake-up call about the link between diabetes and liver health. If diabetes and chronic liver disease, also known as CLD, aren't managed well, they can get worse over time. If you have diabetes, your risk for liver problems increases. The same goes for liver disease, raising the chances of diabetes. It's a two-way street, especially if either condition is advanced. Let's talk about what makes these risks higher. Key factors increasing risk. For type 2 diabetes, being over 45 years old, being overweight or obese, smoking, leading a sedentary lifestyle, a family history of diabetes, having metabolic-associated fatty liver disease, also known as MASLD. For chronic liver disease, being over 60 years old, being overweight or obese, smoking, drinking alcohol excessively, having hepatitis B or C, having type 2 diabetes. As we explore this connection further, we uncover a world where the fight against diabetes is not just about managing blood sugar, but also about understanding and safeguarding the liver, an organ pivotal in the intricate dance of health and disease. In our journey, we will also shed light on some lesser-known yet significant aspects of this battle, the risks of liver cancer and the impacts of diabetes medications on liver health. Stay tuned as we delve into these crucial topics, offering insights and information that are vital for everyone touched by diabetes. We will start with insulin resistance, a common problem in type 2 diabetes. This means the body's cells don't respond well to insulin, a hormone that helps sugar move from the blood into the cells. When this system fails, the liver doesn't stop making sugar, leading to excess sugar in the blood. This can be tough on the liver, which has to filter harmful substances, aid in digestion, and regulate blood sugar. Constantly high sugar levels put the liver under stress, eventually causing damage. Properly managing blood sugar, therefore, is crucial not just for controlling diabetes but also for maintaining liver health. Number 2. Fatty liver disease. In the context of diabetes, non-alcoholic fatty liver disease, or NAFLD for short, marks a significant concern. Characterized by excess fat in liver cells, NAFLD stems from the body's impaired processing of sugar and fat due to diabetes. This condition goes beyond simple fat accumulation. It sets off a chain reaction that can severely impact liver health. NAFLD often starts silently but can progressively worsen, leading to inflammation and cell damage in the liver, known as steatohepatitis. If unchecked, this inflammation advances to fibrosis, where scar tissue disrupts liver function. The link between NAFLD and metabolic syndrome, common in type 2 diabetes, further elevates liver damage risks. Number 3. Liver inflammation. As we navigate further into the impacts of diabetes on liver health, we encounter a pivotal stage, liver inflammation, medically known as steatohepatitis, as we mentioned in number 2. This stage represents a critical shift from the mere presence of fat in the liver to an active inflammatory response. In diabetes, this inflammation is a direct result of prolonged high blood sugar levels and the liver's continued exposure to excess fat. The significance of liver inflammation in diabetes lies in its potential to cause substantial and irreversible damage. The liver, swollen and under stress, starts to lose its ability to function efficiently. This inflammation disrupts the liver's vital roles, such as processing nutrients, filtering toxins, and managing medications. The real danger lies in its silent progression, often without noticeable symptoms, making it a covert threat to liver health. Let's talk about cirrhosis, a serious liver problem caused by long-term diabetes. Cirrhosis happens when there's too much inflammation in the liver for too long, and the healthy liver tissue starts turning into scar tissue. The implications for liver function are substantial and multifaceted. Scar tissue impairs the liver's capacity to process nutrients and filter harmful substances from the blood, a critical function for overall health. It also affects the liver's ability to metabolize and manage medications, potentially disrupting treatment plans for diabetes and other conditions. Furthermore, cirrhosis can severely impact the liver's role in aiding digestion, specifically in the production and flow of bile, which is essential for breaking down fats. In advanced stages, cirrhosis may lead to liver failure, where the liver loses its ability to perform these vital tasks altogether. Number 5. Increased risk of liver cancer. Chronic liver conditions and damage associated with diabetes significantly increase the risk of liver cancer, particularly hepatocellular carcinoma, HCC. HCC is the most common type of primary liver cancer and often develops in livers that have been chronically damaged by conditions like cirrhosis or hepatitis. In the context of diabetes, the ongoing inflammation, cell damage, and scarring in the liver create an environment conducive to the development of HCC. The altered liver cells in a scarred and inflamed liver are more susceptible to turning cancerous. Number 6. Hepatitis. In diabetes, the risk of developing a specific type of hepatitis, known as non-viral hepatitis, is heightened. This form of hepatitis is characterized by liver inflammation resulting not from an infection, but from metabolic issues linked to diabetes, such as insulin resistance and fatty liver. The symptoms, which may include fatigue, abdominal discomfort, and jaundice, differ from viral hepatitis and are directly related to the metabolic disturbances in diabetes. This type of hepatitis can progress to more serious liver damage and scarring if not addressed, emphasizing the need for careful monitoring and management of liver health in diabetic patients. Number 7. Impaired liver function. Diabetes, through its various impacts on the liver, leads to a cumulative impairment of liver function. Conditions like insulin resistance, fatty liver disease, and hepatitis collectively contribute to this decline. As a result, the liver's ability to filter toxins, manage blood sugar and fat levels, and process nutrients and medications is compromised, leading to systemic health issues. Number 8. Liver enzyme abnormalities. Diabetes can lead to abnormalities in liver enzymes, which are indicators of liver health. High blood sugar levels and associated liver damage can cause changes in these enzymes, detectable through blood tests. These changes often signal liver stress or damage, and can indicate the onset or progression of liver disease. In a more detailed view, liver enzymes are proteins produced by the liver, playing a crucial role in metabolism. In diabetes, the persistent high blood sugar can overburden the liver, leading to an increased release of these enzymes into the bloodstream. This is often a response to liver stress, inflammation, or damage, potentially due to conditions like fatty liver disease. Regular monitoring of liver enzyme levels in people with diabetes is important as it helps in the early detection and management of liver-related complications. Elevated levels of enzymes like ALT and AST in blood tests are key markers signaling the need for further evaluation and potential intervention for liver health in the context of diabetes management. Number 9. Gallbladder diseases. The risk of gallbladder diseases, including gallstones, is higher in people with diabetes. This increase in risk is partly due to the way diabetes can affect the metabolism of bile and fat, both of which are crucial to gallbladder function. This increases the likelihood of gallstone formation. Gallstones are hard deposits formed in the gallbladder, which mainly store and release bile produced by the liver. Gallbladder issues can, in turn, affect liver health due to the close relationship between these two organs. The liver and gallbladder work together in the digestive system. The liver produces bile, while the gallbladder stores and releases it. Therefore, problems with the gallbladder, like gallstones, can disrupt bile flow and affect the liver. This disruption can lead to liver complications, such as inflammation or bile-induced liver damage. In essence, the health of the gallbladder and liver are interconnected, with diabetes potentially exacerbating issues in both due to altered bile metabolism and fat handling. Number 10. Medication effects. Many medications used to manage diabetes and its complications can impact liver health. Some diabetes medications are known to cause liver enzyme elevations, a sign of liver stress or damage. Other liver-related side effects may include hepatotoxicity, liver toxicity, fatty liver changes, and in rare cases, acute liver failure. These side effects can vary based on the type of medication and the individual's health profile. For instance, drugs like statins used to manage cholesterol levels, and certain oral hypoglycemics can sometimes affect liver function. Regular liver function monitoring is essential for people with diabetes, especially when on long-term medication, to detect and manage any potential liver damage early. Managing diabetes is not just about controlling blood sugar. It also means taking care of your liver. Eating a balanced diet, maintaining a healthy weight, exercising regularly, and following your doctor's advice can help keep both your diabetes and liver in good shape. Remember, regular checkups are key to catching any liver issues early and treating them effectively. But our journey to better health doesn't stop here. I invite you to explore our other videos, each packed with valuable insights and practical tips to help you manage your health more effectively. Together, let's embrace a life of wellness and vitality.